Have you ever left a doctor's office with a stack of test results and gone home more terrified than when you walked in? I want to ask you an uncomfortable question. What if part of that fear wasn't caused by your health, but by the test itself? Today I'm going to show you something that most doctors know, but few talk about openly. Not because it's a lie, but because the truth is more complicated than get all your tests done every year. Stay with me until the end, because around the 20-minute mark, I'm going to give you 3 questions you can keep in your back pocket for any doctor's visit. 3 questions that will completely change your relationship with your doctor and with medical tests. Preventive medicine has saved millions of lives. That's a fact, and I won't dispute it. But there's a huge difference between smart prevention and what I call medicine of fear. And that difference, for those over 60, can cost much more than money. The body of a 70-year-old isn't the body of a 40-year-old. It seems obvious when we put it that way, but in clinical practice, for decades, this difference has been almost completely ignored. Think about it with me. Your body has wrinkles on the outside, gray hair, sunspots on the skin. No one panics about that, right? So why do we act as if the inside is any different? There's a technical term that changes everything in this conversation. It's called overdiagnosis. This happens when a test detects something that would never cause any problems, would never give you symptoms, would never kill you, but that, once on paper, triggers a chain of investigations with real and immediate risks. Biopsies, surgeries, heavy medications, chronic anxiety, depression, all caused not by the disease, but by the test. Test number 1, and this is the most popular and the most treacherous. Have you seen those executive checkup packages, full body imaging, all at once? It looks like healthcare. It looks like responsibility. But let me tell you what really happens next. A patient of mine, I'll call her Teresa, 74 years old. Active, cheerful, she played with her grandchildren every weekend. No symptoms at all. She had a promotional CT scan, just to see how she was doing. The test found a 4 mm nodule in her lung. Her world came crashing down. A marathon began. Oncologist, pulmonologist, more CT scans, biopsy. Weeks of anguish, sleepless nights, crying in secret from her family. The biopsy result? An old scar from pneumonia she had in the 1990s. Benign, no danger at all, but the biopsy caused a partial collapse of her lung. 2 weeks in the hospital, a hospital-acquired infection, 3 months of recovery. A woman who went in healthy came out debilitated. And here is the scientific fact that needs to be part of this conversation. A single whole-body CT scan is equivalent to a radiation dose of 200 to 400 chest X-rays all at once. And research shows that the body's ability to repair radiation damage drops significantly after age 65. In other words, the test that is supposed to detect cancer may, in practice, increase the risk of developing one in the future. My recommendation: CT scans only for specific symptoms, unexplained weight loss, persistent pain, bleeding, a palpable mass. Without symptoms, the risk outweighs the benefit. Test number 2. This one is going to spark some debate, and that's okay. Colonoscopies save lives, that is true. But after age 75, with no intestinal complaints, the risk-benefit calculation changes completely. The intestinal walls become thinner with age. Sedation affects heart rate differently, and that preparation, the liquid that empties the bowel, can cause severe dehydration, a drop in blood pressure, and an imbalance of sodium and potassium. A patient of mine, 79 years old, from Belo Horizonte, he walked every day, active, independent. He took an anticoagulant for his heart, like millions of Brazilians. The doctor ordered a routine colonoscopy, no symptoms whatsoever. On the night of the preparation, severe diarrhea, rapid dehydration, blood pressure dropped. He fainted in the bathroom. His wife called 911. Hospital, stabilization. During the procedure, bleeding in the intestinal wall, difficult to control because of the anticoagulant. Test results? Normal, absolutely normal. A large-scale European study showed, after age 75, for every life saved by asymptomatic colonoscopy screening, 10 people suffer serious complications. The smart alternative exists and is simple: fecal occult blood testing. You receive a kit, do it at home, and send it to the lab. No risk, no sedation, no suffering. If it comes back positive, then a colonoscopy is fully justified, because there's a concrete sign to investigate. Have you ever gone through this preparation? How was it? Tell me in the comments. I read them all and learn a lot from your stories. This one looks completely harmless, a treadmill. It even looks healthy. But the rate of false positives for this test in older people is as high as nearly 40%. Almost half the time, the test says there's a problem when there isn't. And each of these false positives can trigger a catheterization, where they literally insert a catheter through your arm or groin, guide it up to your heart, and inject contrast dye. One of my patients, a 73-year-old man, had severe osteoarthritis in his knees. On the treadmill, he couldn't complete the test, not because of his heart, but because of the unbearable pain. The result came back as inconclusive. He was referred for a catheterization. They found arteries with hardening normal for his age. Even so, they placed a stent as a precaution. There was a vascular complication. He was hospitalized for a week. His heart was functioning well the whole time. Alternative. For those who don't experience chest pain, high blood pressure, or shortness of breath during normal activities, a resting electrocardiogram combined with a thorough clinical evaluation already provides valuable information. No risk, no pain. This is the cruelest one on the list, because it taps into the greatest fear of those who are aging. You forget where you put your keys. You can't remember an actor's name. You walk into a room and forget what you came in for. And your brain immediately fires off that scary word, Alzheimer's. And the instinctive reaction is to rush for an MRI. But what modern neuroscience clearly teaches us is that virtually everyone over 70 shows some degree of atrophy and minor changes on an MRI. This is as normal as having gray hair. They are signs of aging. They are not dementia. Mrs. Marcia, a retired teacher, 71 years old. Lucid, articulate, she taught volunteer literacy classes 3 times a week. She had an MRI done on her own after a minor lapse in memory. The report came back with the words mild cortical atrophy and non-specific changes in the white matter. Mrs. Marcia read that and became convinced she was developing dementia. She stopped leaving the house. She stopped teaching. She cut off contact with her friends. She fell into a deep depression. When she arrived at my office 3 months later, I administered a simple cognitive test using pen and paper. The results were excellent. Good memory, intact reasoning, preserved language skills. Her brain was functioning perfectly. But the emotional damage caused by the test took months to repair. And the most tragic irony? The social isolation she imposed on herself out of fear. That is what actually harms the brain. Loneliness and inactivity are real risk factors for cognitive decline. The test created exactly the problem she feared. Before requesting an MRI, ask your doctor for an in-office cognitive test. It's simple, quick, and much more accurate for assessing how your brain really functions than a static image. The 5th point isn't about the test itself. It's about what happens after the results come back. The word osteopenia appears in the report, and it immediately sets off alarm bells. But osteopenia simply means a mild, natural reduction in bone mass. It's as normal at age 70 as needing reading glasses. It's part of healthy aging. The problem arises when this result leads to powerful medications, bisphosphonates, without a full assessment of the patient's condition. A 76-year-old patient had never fallen in her life. She had never broken anything. She went to the market every Saturday carrying a heavy bag. A bone density scan showed mild osteopenia. She was prescribed the medication. 3 months later, she experienced severe acid reflux, stomach pain, and weight loss. And worse, severe pain in her jaw. The medication prescribed to strengthen her bones was, in rare but documented cases, causing the death of the jawbone. Research shows that treating mild osteopenia with bisphosphonates in people over 70 reduces the risk of fracture by less than 1% after 5 years of treatment. Less than 1%. What really protects your bones isn't medication. It's strong muscles and balance. Because if you don't fall, you don't break. The focus should be entirely on preventing falls. So what should you do? Let me give you a simple, inexpensive, evidence-based plan. 1. Monitor your blood pressure at home. Use a digital upper arm monitor. You can find one for less than 100 reais. Take your reading 3 times a week, in the morning, while seated, after resting for 5 minutes. Write it down in a notebook and bring it to your appointment. Goal below 140/90. In Brazil, where salt consumption is among the highest in the world, uncontrolled blood pressure is the true silent killer. This little device is worth more than any CT scan costing thousands of reais. 2. Measure your waist with a tape measure. At the level of your navel, men, below 94 centimeters, women, under 80 centimeters. This number predicts cardiovascular risk better than many sophisticated tests. 3. Pay attention to your walking speed. It seems simple, but in geriatrics, walking speed is considered the sixth vital sign. If you're slowing down, if people are passing you on the sidewalk, that's a more important sign than any spot on an imaging test. 4. Test your hand strength. Can you open a jar of preserves? Squeeze a tennis ball firmly? Grip strength reflects the muscular health of your entire body. 5. Sun and sardines. 15 minutes of daily sun on your arms and legs. Canned sardines with bones are a highly absorbable source of organic calcium, much more effective than a pill. 6. Active social interaction. Science shows that isolation is literally more toxic to the brain than smoking a pack a day. That quick coffee with the neighbor, the chat circle in the square, it's pure neuroprotection. Now here's what I promised at the beginning. 3 questions you can take to any appointment. Write them down. Question 1. Doctor, will the results of this test actually change my treatment plan? Question 2. What are the real risks of not doing this now and just monitoring my symptoms? Question 3. If it were your father or mother at my age, would you recommend this procedure? A doctor who values ethics will be happy to hear these questions. Not offended, happy. Because that's exactly what an informed, engaged patient does. You're not obligated to passively accept everything that's proposed. Health is a partnership. And the best partner you can have on this journey is information. If this video resonated with you, do one thing right now. Share it with someone you love. A family member, a friend, someone who is going through this anxiety of test after test without understanding why. Subscribe to the channel. Every week there's content like this, real information, without sensationalism, without unnecessary fear. Leave a comment, tell me if you've ever been through any of these situations. I read them all, and your story might help someone else who's watching this video right now. Taking care of your health isn't about submitting to everything. It's about making the right choices, with information, with awareness, and with a good doctor by your side. See you in the next video.